a very good evening. Let's get started on a quick topic that would be syndromes mini test. This was a test where we would be testing your knowledge with respect to especially the commonly asked syndromes. I think that you would have got a very good score in this test because this was mainly focusing on the basics. So let me just see if you are okay with the audio and the visual part, and then we can move on to the first question for today. Pretty a straightforward one. I'll just bring it into focus relatively better. Just like if I can adjust the settings, you will be able to see the question relatively better. So just give me a second. Yeah, I think this is much better as a view. We have this 6-month-old infant, and then there are delayed developmental milestones. The characteristic manifestation is also shown, and there are characteristic facial features which I don't need to say because then the diagnosis will become obvious. There is presence of hypotonia, wide split second heart sound, left axis deviation on the ECG, and he says what is the heart disease that is most likely. So when you look at the peculiar facial features of this patient, the slant in the eyes of the patient, which I can zoom in at the moment, that is a mongoloid slant, and more importantly the flat facial profile of this case. So I can say that I'm dealing with a case of Down syndrome. Now the question is obviously not on Down syndrome, but is mainly based on like what are the manifestations that would be seen in this patient from the cardiovascular perspective. The manifestation in the eyes of this patient would be mainly with respect to the mongoloid slant and the flat facial profile that is present. Low set ears, though for low set ears I would need to evaluate the back of the patient as well, but the question really does not need that. So I think you are aware of the fact that wide split second heart sound would indicate that it could either be a VST or it could be also a atrial septal defect. But considering that is mentioned a left axis deviation, so we need to be a little more, I would say, proactive for the diagnosis in this case. Perimembranous VST and muscular VST are two very close options. Both would be having is presence of a wide variable split second heart sound, whereas when it comes to AST, it is a wide fixed split second heart sound. Now the point that I want to make here is because is mentioning the word left axis deviation, which normally is not the case with respect to left to right sided shunts, because most of the time you would be having like all the blood of the left going towards right. But considering a 6-month-old infant and then there is a ECG showing a wide split second heart sound, is not specified fixed versus variable. So he's left the question open to us with respect to only one word, that is a left axis deviation. But considering that, I'll favor this as going in favor of ostium primum, though that is relatively less common. What is more common is a AST, that is ostium secundum, but then ostium secundum always presents with a right axis deviation. And for VST, I can say that it will become symptomatic even much more earlier, and along with that, yes, the right axis deviation can be present. So considering the first question for today, I'll check out your responses also, but I think that you have been able to work out the answer to this question. The discussion today is based on the topic of syndromes, and the first one I think is a pretty easy one. Okay. Yeah, I got A as a vocal answer there, so not bad. I mean, that only thing is ostium secundum में right axis deviation होता है, so that is why the answer here is slightly different from what you were thinking. I'll just use a font size that is relatively bigger, guys. If you look at this image, though it just went off a bit, here that I've highlighted is presence of Down syndrome. That is one, flat facial profile, and then I mentioned regarding the mongoloid slant. Okay. And then what I've highlighted is the main presence of left axis deviation, which is AV canal defect, also called as endocardial cushion defect, which is one of the common heart diseases that we see. And point against that VST part would be one, that VST can become symptomatic early. It can become symptomatic later also, but then the point to be taken here from the proactive perspective would be that ventricular septal defect usually would end up with a right axis deviation. So we are sorted for the first one for today. Let's look at the second question. Yep, good evening guys. The second one is regarding a teenage girl, and she is presenting with short stature and absence of secondary sexual characteristics. You can notice that there's a characteristic webbing of the neck that can be seen in this girl. There is hypoplastic nipples that are being highlighted. So considering a teenage girl with webbing of neck, the diagnosis in this case is pretty straightforward. That is Turner syndrome. But then what he is asking you is actually a two-step question. From the two-step perspective, is saying what is the valvular lesion that would be present, or what is the interpretation based on the murmur. One of the vocal answers that has come up in this question is option number B, that is bicuspid aortic valve. So I agree to the fact that the bicuspid aortic valve is one of the commonest valvular lesions seen in patients of Turner syndrome. But the answer to this question is not option number B. Please appreciate the, I would say, the keywords in a question. Here he's saying the word continuous murmur. तो bicuspid aortic valve में तो continuous murmur होता नहीं है ना. Bicuspid aortic valve will behave like valvular aortic stenosis, and that will be causing is a ejection systolic murmur. The reason why answer is not option number B for this question is based on the fact that bicuspid aortic valve causes valvular aortic stenosis like presentation and has a ejection systolic murmur. Pulmonic stenosis also has a ejection systolic murmur, so both are ruled out. You are now left with either peripheral pulmonic stenosis or coarctation of aorta. So what is more common in these patients? More common in these patients is coarctation of aorta. So the correct answer to this question is option number A. The question was not asking you regarding the cause of death, or was not asking you with respect to what is the common valvular lesion. So we need to steer clear of the stereotype. Normally whenever we are attempting questions, what happens is we assume an answer to a question. Here all you need to do is avoid that stereotype primarily. So I think that is what has happened here. The correct answer for the current question is option number A. We can move to the next one. This is a 17-year-old male with a very tall height, elongated, slender fingers are being evaluated. So when you are checking out the question, you can notice that Steinbert sign, the thumb sign. What you can also see in this particular case is arachnodactyly. So I know that I'm dealing with a patient who's having Marfan syndrome, and all the four options are having FBN1 present. He's saying what is the the common association that is present. So in Marfan syndrome, one of the common associations that we will be getting is mitral valve prolapse. And when we are having a mitral valve prolapse in a patient, then the auscultatory finding that we get in this case is mainly going to be a late systolic murmur and mid systolic clicks. So the correct answer to this question is option number A. We just had to analyze the fact that there is MVP present based on mid systolic clicks. Mid systolic murmur is what you see with the aortic stenosis or pulmonic stenosis. And among the remaining ones, well, we have is a aortic dissection, but we don't have is a aortic aneurysm, aortic transaction in this case. So as a result of this, the remaining options can be ruled out. The correct answer to this question is option number A. Okay, so people are doing questions along with me also. Flushing, diarrhea and wheezing. I mean, that's again, a very easy one to identify because there is episodic flushing. See, the keyword is flushing present, vasodilation, and then is mentioned the test here, 24 hydroxyindole acetic acid levels or HIAA levels. For any question that deals with HIAA levels, you know that you're dealing with a carcinoid tumor. So the correct answer in the next one on the agenda is option number D. Carcinoid tumor can be identified on basis of the keyword 5 HIAA levels in this patient. Moreover, he has also mentioned the right-sided heart murmur. So you guys can comment in the chat box quickly with respect to what are the common valvular regions seen here. I'll just wait for your answers for next 10 seconds. Yes, guys, common valvular lesion that would be seen in any patient. Yes, TIPS is the mnemonic for it. Tricuspid insufficiency and pulmonic stenosis. These questions are confidence building measures, guys. There are some questions which are easy and straightforward. Some of them are going to be having a bit of twist present. Like if you look at the second question that I discussed, there it was like we are assuming an answer and it turned out to be different. And there are some which are like right in your face and you can identify them on the keywords that I'm highlighting before you. So this is, no, it is not tricuspid stenosis, man. It is not tricuspid stenosis, it is tricuspid insufficiency, and then is going to be a pulmonic stenosis. So the correct answer for this question would be given as option number D. Okay. Then is which of the following criteria is not a part of metabolic syndrome. The not word is present here, and when you read that, you can identify metabolic syndrome is कि sugar भी बढ़ती है, fats भी बढ़ते हैं, tummy भी बढ़ जाता है, lipid profile भी derange होता है, and it is gonna be like the main thing is that triglycerides are elevated and HDL is low. And here if you evaluate the options here, like if you check out whatever is given, blood pressure is elevated because there is centripetal obesity, there would be tummy fat present in this guy. Fasting blood sugar would also be elevated because any person with obesity, there is bound to be impaired fasting glucose present. So even the first one makes sense. Waist circumference will increase. I mean, I said tummy fat present, so it's okay. But then not a component of this is LDL. Na baki sab mein LDL hota hai. In all the scores that you are analyzing, you will notice that LDL will come in the picture. But when it comes to this particular score, what you need to evaluate is that it is hypertriglyceridemia. And along with that, the high density lipoprotein values would be lesser. So it is not a increased LDL. In all others, it is an increased LDL. But for this one, it would be primarily HDL that would be taken into consideration. So the correct answer to this question is option number D. Criteria not a part of metabolic syndrome is the one that is currently on the agenda. Now we're talking about a woman. She's having irregular menstrual cycles, acne, excessive facial hair growth. The weight is also, going towards overweight, not obese, overweight. And then you can see that characteristic ring sign present here. So considering the information that is present in this case with that ring appearance or like the string of pearls appearance, I can say this would be premature ovarian failure. Okay, no, bache, that would be a simple polycystic ovarian syndrome. He did not talk about any manifestations related to premature ovarian failure. Any patient who's having that obesity component with excessive facial hair growth, hirsutism, acne, irregular menstrual cycles, and that characteristic ultrasound finding would be PCOD in a patient. So pretty an easy one. Next, we are discussing regarding a patient who's having a treatment-resistant peptic ulcers. Now, the point to be understood is whenever you read this word treatment-resistant peptic ulcers, it always points towards that the patient is suffering from query Zollinger-Ellison syndrome, and he is given an outrageous value of gastrin that is like 100 picogram per ml. So if you look at this information that is provided, treatment-resistant peptic ulcer, gastrin being elevated, this is going to be answered as option number A, Zollinger-Ellison syndrome. More importantly is mentioned a pancreatic mass. That's a little atypical because traditionally in a Zollinger-Ellison, the most common site is going to be the second part of duodenum. Yeah, it's located in Passaro's triangle. The most common location is the overall most common location that we find is the duodenum. First or second part of duodenum. But when it comes to like this presentation, this is the second most common site. So that rather also favors that there could be concomitant multiple endocrine neoplasia present in this case. But the answer for this question is option number A. Coming to the eighth one for this session, we have this 60-year-old smoker. Facial swelling, dilated neck veins. Smoker with dilated neck veins are the keywords, the buzzwords that you need to pick up here. The shortness of breath is worsening on lying flat, and then you can notice in the X-ray also is trying to show a lesion in the right upper zone of this patient. Considering that a smoker is having a lung mass and there are dilated neck veins, the diagnosis becomes pretty straightforward. Pulmonary embolism is unlikely because pulmonary embolism would always contribute to shortness of breath. More importantly, the issue with pulmonary embolism that would always be coming is the crushing of the blood pressure of the patient. Pericardial tamponade again is a condition that causes obstructive shock. Both A and B are like conditions where hemodynamic compromise can be present. So either it will be a case of heart failure or a superior vena cava syndrome. And then for heart failure, because why I said heart failure, because dilated veins are given. But considering smoker neck veins, the first priority with the lung mass would be always thought of as a superior vena cava syndrome. The answer to this condition is option number D. One of the leading causes for superior vena cava syndrome is small cell cancer or oat cell cancer of the lung. So these are like pretty straightforward ones, I'll say. Moving to the ninth one, there is an injury in the tibia of the patient. The leg is swollen and then the passive stretching of the toes is causing pain. So what we are talking about in this case is compartment syndrome. Now you guys just have to answer for like appropriate immediate management for compartment syndrome here. Yeah, you can notice, no, even if you are saying for the X-ray, if you look at the area right upper zone, you can notice that there is a lung mass present. I'll just erase that since you raised this query. Like if you look at the area that I've currently highlighted, or I'm highlighting now, you can notice the lung mass in the right upper zone of the patient, just hidden with respect to the clavicle, which goes in favor of oat cell cancer. Next is a patient who's having compartment syndrome, and whenever we consider compartment syndrome into a consideration, we have to, in the case, perform a urgent fasciotomy. The correct answer for this one is option number C. I mean, I would not like to wait for anything else. Elevation of limb and apply as ice packs is for like localized swelling. When there's a compartment syndrome, there is a risk of development of gangrene in a patient as well. So we need to be a little aggressive. We need to be a little proactive. And that is why the correct answer for this is option number C. Yeah, pressure values more than 30 would indicate that there is a higher chances of development of compartment manifestations. Okay. Next, we have this woman with weight gain, purple stripe on her abdomen and muscle weakness. I just wanted to keep it simple. So the answer in this case is Cushing syndrome. What you are supposed to do is let me know the investigation choice for Cushing syndrome. Yes, guys, you get marks for this one if you let me know investigation choice for Cushing syndrome. Yeah, the answer is C. That's I hid the face deliberately behind me because then you know that this is Cushing, and the purple stripe is the dead giveaway. That tells you that, okay, I'm dealing with Cushing syndrome. Low dose dexamethasone is a good answer. Actually, like the more appropriate test in this case would be a midnight salivary cortisol, because at 12 o'clock in the night in a normal person, the cortisol values would be less. But in these patients, what will happen is that because it is a hormone, I mean, there is some source of hormone. It could be ectopic, it could be endogenous, it could be an autonomous source. So therefore, when you evaluate these patients, it is always advisable to go for a midnight salivary cortisol values, which would be significantly elevated. And yeah, one more test that we can do is a low dose dexamethasone suppression test, but on a comparison basis. Like if you follow the information, midnight salivary cortisol will have a higher diagnostic accuracy as compared to low dose dexona. And as far as high dose dexamethasone is concerned, the high dose dexamethasone is for etiological diagnosis, that is to differentiate between whether a patient is having lung cancer versus pituitary adenoma. So that is, yeah, the screening one is right, Lokesh. That would be 24-hour urinary cortisol. So 10th is sorted. Let's move to the next one. There is fatigue, weight loss, and skin darkening present. Hyperpigmentation of the knuckles is telling you that ACTH in the patient is elevated. We have discussed that ACTH has a partial MSH-like activity. Now, because there is presence of hypotension with hyponatremia, so that tells me problem is with the, yes, aldosterone in the patient. Sodium and potassium always have an inverse relation. So if you're looking at the information, he is one himself saying the fact that aldosterone in the body of this patient is low, cortisol is also low, and ACTH is elevated. I mean, if you look at the information that is given in this question, you can work out the interpretation, which would be in the form of Addison disease. The answer to this question is option number A. Yeah, the test we'll do in this case is a ACTH stimulation test. But then what you need to understand or remember for this particular question is mainly the fact that if sodium and potassium are going in opposite direction in any question, it tells you that the problem lies with aldosterone. And along with that, we will be giving hydrocortisone lifelong for replacement of these patients. So the correct answer to the 11th one on the agenda is option number B. Next is a patient who comes with ascending paralysis following a respiratory infection, and there is like these increased proteins present with a normal cell count, and he says like what is the primary pathological process in this case. So the primary pathological process for this case to be considered is obviously, I mean, the diagnosis is clear, Guillain-Barré syndrome. You can let me know what you think is the answer for this one. Yes. Yep. Demyelination of the spinal cord is a feature that you would be getting with neuromyelitis optica, and we are not dealing with NMO at the moment. So it is demyelination of the peripheral nerves. That would be the key thing for this particular case. The correct answer for this question is option number B. The correct answer for this particular question would be option number B. Okay. Moving to the next question. The treatment of choice is intravenous immunoglobulins. I'll let you evaluate this. A 10-year-old boy is coming with occipital headache, neck pain, and unsteady gait. MRI of the brain is shown. So I'll just zoom into the MRI here. And if you look at the MRI, what is happening is that the cerebellar tonsils in this case are herniating downwards. This downward herniation of the cerebellar tonsils is causing a small posterior fossa, because if you look at like the fourth ventricle in this case, then you will notice that the fourth ventricle in this case is relatively smaller. So I'm dealing with like if I say anything, the answer will become obvious. So yes, guys, you guys can let me know whatever you are evaluating for this patient. I'll just bring the options to your attention. Inferior displacement of the cerebellar tonsils. Occipital headache is a good hint in a question, especially from the perspective of concomitant neck pain also, and a gait. Unsteady gait is because the cerebellum is getting involved in this case. So the correct answer in this case is Arnold-Chiari malformation. Yes, guys, the main feature that you need to remember for this case is AC malformations, Arnold-Chiari, and that is primarily based on the fact that the key finding is the inferior displacement of the cerebellar tonsils. Dandy-Walker syndrome is what I will be introducing in my subsequent discussions with you, but for today, every time you get is the inferior displacement of cerebellar tonsils, it is Arnold-Chiari. Arnold-Chiari malformation is total of 4 varieties. Type 3 and type 4 are usually not compatible with life. Type 1 is associated with syringomelia, and when type 2, it's usually associated with myelomeningocele. But the way the manifestations are given, the answer in this case would be Arnold-Chiari malformation. That cape-like symptoms are a feature that are seen with the syringomelia. That would be, that cape-like symptoms are gonna be occurring in a patient maybe later. But at this moment, it is like that cerebellar manifestation of unsteady gait that is the predominant manifestations. Next is a question which is dealing with drooping of the eyelid, pupillary constriction, absence of sweating on the same side of the face. And then if you look at the manifestations here, they're very, very characteristic. The correct answer in this case would be interruption of the sympathomimetic activity. That would be the interruption of the sympathomimetic activity. That would be a very characteristic feature that is seen with Horner syndrome. Yes, the correct answer in this case is option number D. No, not a parasympathomimetic. He says what best gonna explain this. So in Horner syndrome, the perfect manifestations are there. In a perfect meal, ptosis, meiosis, enophthalmos, anhidrosis, and the loss of ciliospinal reflex. So all you need to pick up in this question is that there is an interruption of the sympathomimetic pathway for this. Yes. Okay. I was not aware that this would be an interruption of a sympathomimetic pathway. Okay, moving to the 15th one. We are having a chronic smoker and he is presenting with that proximal muscle weakness that improves with repeated activity. The examination in this case shows absent deep tendon reflexes with nerve conduction studies showing an increased compound muscle action potential after repeated stimulation. The moment I am saying that the weakness is improving with repeated activity, I think you can cease reading the question subsequently, and the answer in this case would then become Lambert-Eaton syndrome, whereas when all the other situations like myasthenia gravis will always be having is a decremental response. The other options can be ruled out. Polio will be presenting with asymmetrical flaccidity. Guillain-Barré syndrome is that ascending symmetrical flaccid paralysis. So between the options that we have to take into consideration, Lambert-Eaton is like what we basically need to remember. Moving to the 17th one, the boy is having delayed puberty with a small testis. And the moment I say tall boy with a small testis, and if you look at the chromosomal representation here as well, you will be able to figure out that either you can solve this question by looking at the karyotyping 47XXY, or all you need to do is check out like tall guy with small testes, long limbs, and the remaining manifestations which help you in identifying the condition as Klinefelter syndrome. So these are like those grabbing those MCQs. We now have is a 20-year-old woman. She's having a hyperextensible skin, hypermobile joints, and a easy bruisability. Considering that there would be a hyperextensible skin, hypermobile joints, and then more importantly easy bruisability, you are able to pick up that we're dealing with Ehlers-Danlos syndrome. And then he has mentioned the gene also, which will make the life of ours relatively easier. Yes, guys, I think this is an easy one. Defect of type 5 collagen synthesis is what is happening in EDS, that is Ehlers-Danlos syndrome. So yeah, keep commenting, guys. I don't think so. This is more a straightforward question. All you have to pick up was hyperextensible skin, and then more importantly, hypermobile joints, easy bruisability, COL5A gene. I mean, if he has written COL5A gene, you know that you're dealing with a defect in type 5 collagen synthesis. Okay. Next is on dryness of the eyes and mouth for the past 6 months in a patient, and there's a decreased tear production and dental caries. So I'm dealing with dry eyes and a dry mouth. And when I say dry eye is dry mouth in a patient, I'm dealing with Sjögren syndrome. And this is an autoimmune disorder in which there would be like autoimmune destruction of the exocrine glands that would be happening. You can also solve this question on the basis of these antibodies here, that is Rho antibody and La antibodies, that is SSA and SSB antibody. That helps you in identifying this condition as well. So 18th is like Sjögren, right in your face kind of a question based on antibody or dry eyes and dry mouth features. Next is for a child who's brought to the clinic for hypotonia, poor feeding in infancy, delayed motor milestones, intellectual disability. Okay, so this is generic. But then he is mentioning the deletion of the paternal chromosome. So I know I'm dealing with Prader-Willi, the chromosome that would be involved in this particular question. Yes, doctor. NEET 25. Okay, yeah. I mean, questions are like the recent ones only. That is why we're discussing them. So for this one, I don't think so anybody would have any challenge. I mean, dry eyes, dry mouth, opening में लिखा है तो rheumatoid, it has to be like, you know, Sjögren syndrome to be considered. And we'll do a small, I mean, what we do for diagnosis of this condition will be a biopsy of the minor salivary glands. And for the 19th one, that is the second one for today, it is chromosome 15. In fact, in this discussion, I think it should be 100% score or more than 80% score that you need to obtain, because some of the papers that have come recently are like super easy. So here it is like we're talking about 80 to 90% score getting right, and the negative marks have to be metabolized. C option for doc, it's more based on like the random options have been created. I mean, fibrilin is one which is for Marfan syndrome, and then it's like defective hydroxylation. So I can say it could be like related to maybe like vitamin C deficiency, or it could be related to even zinc deficiency, that the hydroxylation part can be there. But then it's like type 5 collagen based on COL5A is what I would like to evaluate here. Moving to the 20th one, I deliberately kept this one because 15th was being discussed, but then yes guys, looks like a girl there, right? Looks like a, okay, so the image here, it looks like a girl here from the braids of the hair that would be present. So yeah, this would be Angelman syndrome. So I think the scores in this question or this test would have been like rocking in the range of about 17 to 18. Do comment in the chat box with respect to how many did you get for today. And I'll be back with another test series that is based on diagnostic tests subsequently. But yeah, happy puppets. And then do check out those which, if you had any issues, like, you know, maybe in the second or third, I thought that there was like little bit, like in the first two questions, there was a bit of like disconcerting answers coming up. Maybe because it's the beginning and that's why some errors were there. But if you are going to analyze them, then you can do this better. So yes, you are on the right track, and we are on the way to support you in your journey. So I'll see you again once again. On Sunday, we have a test again lined up. That would be, that's in the TNE in the FMG section. It's obstetrics and gynecology. So more facts again. And then the mini diagnostic test is what I'll be seeing you subsequently. So thank you guys. Take care and God bless you. Take care. Bye-bye.